Good evening. This is Violet Haldane of the West Indian Foundation, and this is another community conversation with the Community Coalition. This evening, our topic will be COVID-19, Stories from the Frontline. Our moderator will be Dr. Fiona Vernal, an associate professor at the University of Connecticut in the History Department. I'll now turn it over to Dr. Vernal.
Good evening, everyone. Thank you for being here. This event is being sponsored by the Hartford Foundation for Public Giving, the City of Hartford, and various coalition members. Countless headlines have documented the disproportionate impact that COVID is having on Black and Brown communities across the country, with higher risks, higher hospitalizations, and higher death rates. We understand that where people work also plays an important role in the kind of risk factors that essential workers and their families face. The premise of this gathering is to hear from essential workers on the front lines and to give them a platform to share their stories with us and to be able to publicize it after this event. Our panel will begin with keynote Kdean Mitchell, who's the Executive Director of Brightview Senior Living. Thereafter, we will turn to several CNAs who will offer up their views of what their experiences have been like. Again, thank you all for being here. We will now turn it over to Ms. Mitchell, who is going to start us off with a keynote and a PowerPoint. Kadine, since we have an hour while you're waiting to address your audio, why don't we reverse the order of the program, and we will hear from Ms. Edwards.
You hear me?
Yes.
Okay. Well, working with the elderly during the COVID, that experience was horrific. It was shocking. It was mind-boggling. Each day we go to work would be different stuff that is going on. We didn't get any information of what to do if the COVID had get in our building. When workers asked, why don't we use PPE before, they were told they have to wait until COVID get in the building. That's something we could not understand. There were times where the PPE was recycled and the disposable PPE was recycled, one-time use, and they washed them. There were times where we was to wear the mask for a whole week. There were times when...
Okay, are you able to hear me now?
Yes, Kadine. So we will continue with Ms. Edwards' presentation, and then we will signal to you to do your presentation. Thank you.
Okay.
Ms. Edwards, you were saying that you had to wear the mask for a whole week.
Yes, we have to wear the mask for a whole week. And we were wearing just the blue surgical mask or the yellow surgical mask. There was one particular event that took place where 3 of the residents came down with getting sick, and we reported it. And they said that they were just having regular flu, just flu symptoms. And we had was to take care of them. So we were only wearing the blue or the yellow surgical mask. About 4 days passed, then they came and they said, oh no, we can't wear that kind of mask. And they gave us a different kind of mask, which was much thicker. And we were given the order that each day we come, this is the kind of mask we were gonna wear. And by the following day when we came to work, there was none of that mask. And we were all appalled of what kind of condition is this? They are telling us you have to wear the good mask to go into that room because of what is going on with the patient. But when the time comes, there is nothing to wear. So it makes us confused, it makes us angry, it makes us not trust in the boss, you know, because they are the ones that's supposed to be protecting us, the workers, so we can take care of the resident the proper way. There are so many different stories and so many incidents that take place inside of the facilities, and especially my facility. You guys want to hear more?
You have 2 minutes.
Okay.
So, yes.
I didn't know. Okay, I want to read you a passage from what I wrote. This is, the infection control nurse came to the unit. Pam began to take masks out of the small box, but the masks were the regular yellow masks. We were appalled at the major offer of insufficient protection. Why are they cutting corners? Where did all the other blue masks go? Why are we not getting any? Also, Pam was touching the mask all over. We all told her that we did not want masks that she had her hands all over. We said that we would take the masks from the box ourselves. We had to take the yellow masks as there were no other choice. Pam offered us only one mask each. That was not going to work. We took 2 each so that the masks were as thick as the blue masks. We were supposed to be wearing.
Thank you, Ms. Edwards, for reading that. She is reading from this book, Care Under COVID, where other home care, healthcare workers, those on the front lines tell their stories. A little bit later on, we would like to hear some more information about how those in the audience can get a copy of that book. Thank you for sharing the story of trauma, of confusion, of the lack of trust, and what seems to be the lack of leadership in these kinds of settings, and the implications for you and your co-workers, not to mention the implications for your family. If we could transition now to Ms. Mitchell, are you ready to share your presentation with us?
Yes, I believe so.
Thank you. So this is Kdean Mitchell, again, the Executive Director of Brightview Senior Living.
Forgive me for the delay and technical difficulties. I join you by way of Maryland, but I was raised in Bloomfield, Connecticut area, very involved in the Hartford area as well, and served with the West Indian Social Organization for several years before moving here for graduate school. So I come from a long line of working in skilled nursing communities, having witnessed my mother work at a very common one in the area for the past 37 years. My memory serves back to going to work with her from the tender age of 3. And so the moment I was able to get a paid position at 15, I began with the goal to become an administrator. And I studied long-term studies throughout undergrad and graduate studies, and have been serving in administration in various nursing homes in the Maryland area. Thankfully, my experience has lent me to serve in multiple populations, inner city to affluent, and all that in between. I've currently been with my organization 5.5 years, and similar to everyone else, am trying to navigate these uncharted waters of COVID-19. So I'm hoping my presentation tonight can lend some insight to trends, observations. Everyone's experiences are vastly different, as we just heard recently, and touch on how we can best get through and some tips there. So the first order of business is simple. It's how are you? And it seems like such a general question, but in times like these, it's very important as an employer to check in routinely and to serve in constant communication with their team. The feelings associated with these uncharted territories are so many. I speak for myself. When this first happened, the very first thought I had was, how do I protect my 90+ residents from not getting this and from not passing away prematurely? One of the second leading thoughts I had was, how do I protect myself and protect myself from bringing it home to my family where I had young ones in my household? So there was a two-part concern. And so there was fear, anxiety, stress, and instability. I would love for everyone to join in the chat if you've recognized or felt any of those feelings, to select number 1 or just simply enter number 1. As we continue on, I recommend and urge everyone to ask that of their friends, of their colleagues, of their team that they're working with as well. Allowing people to identify their feelings has served monumental, even if there's not a current solution at the time. At my particular organization, we had an entire session on virtual homeschooling. This is something that vastly affected our team members. We had lots of caregivers with young ones at home, multiple ages, having to navigate how to support them with varied schedules. For us, we allowed for changes in scheduling. We allow that to support as best as we can. For example, we had a caregiver who was scheduled 6 a.m. to 2:30 on a daily basis prior to the pandemic. As a result, she volunteered to come in early around 3:30 to 4 each day to start AM care, in which she took a break, went home, got her children ready for homeschool, got them started on their day, and then came back to work to finish their shift. These were areas that we found that we had to support our team and to become flexible with, because we knew that there were competing challenges between home and the work area. So let's touch a little bit about unemployment, because as we know, there's no shortage of coverage that nationally people were affected dramatically by the pandemic, as well as at the state level. The country in April saw the highest unemployment rate that they've seen since 1948 at approximately 15%. Thankfully, that has since gone down, and most recently in December, it was noted that the national unemployment rate was closer to 7%. However, this is still very high. For Connecticut, our most recent solid data is showing that it's projected to be around 9 to 10%, most recently November 2020, 8.2%. Thankfully, and not thankfully, we'll explore that momentarily, this served as an area that was a benefit for the most part for healthcare workers, as we were quickly deemed essential workers. The most affected industries served as the hospitality industry as the #1 most negatively affected, and the mining industry as the second most affected. So with this recent surge of unemployment from the hospitality industry, some might think that staffing challenges for healthcare workers would be dissolved, as we would get an amazing influx of new applicants. Would love to hear from participants later on to see if that was something that they experienced at their organization. I will share at ours, that was the opposite. We did not experience that. There were various benefits given at state levels in Connecticut as well as in Maryland, which allowed for an additional premium on top of your unemployment benefit. When we calculated the numbers as administrators, it paid for some positions to stay home and apply for unemployment than it did to come to work every day. So therefore, we weren't seeing a lot of new applicants. In addition, we also had to combat current associates saying, well, it's easier for me to get fired so I can get unemployment. So we addressed that head on, and we spoke to individuals who shared those thoughts with us, and we tried to work through concerns and ways that we can make things better. The second part that I believe strongly we did not see a larger influx of new applicants interested in healthcare was because of the fear of the unknown. For us, COVID-19, while it was very new, was not the first go-round of infections that we were used to. We had lots of experience dealing with the GI bug, the flu, and so proper PEE was not completely new to us. Protecting ourselves and disinfecting, protecting our families was not completely new to us. But for people who are not familiar with the healthcare setting, this was not an attractive field. So as a result, staffing in many organizations, skilled nursing, assisted living, long-term care, became very strained. This was combat with having to be out for exposure and or actually becoming positive with COVID-19. The CDC changed the regulations varying from 10 to 14 days out of work, depending upon your situation, depending upon if you had exposure or actively COVID-19. We actually found that you were out of work less days if you were positive, deemed positive, than if you had possible exposure, because the possible exposure required more additional days to see if you would get positive versus already knowing that you were positive. So for us, the staffing challenges that we faced were that without any notice, we had multiple caregivers and other associates no longer able to come to work for an extended amount of time. That lends for some organizations the use of non-employed associates in the form of agency use. So we've experienced a gamut of that. In addition to the associates that we have brought on, a lot of them use this as a temporary means. They were in other industries that were affected, and they came on board very spirited, but within a few months, when opportunities may have opened up, as we saw the unemployment numbers go down in the last couple of months, they may have jumped back into their previous careers. So there are definitely staffing strains that have been ongoing and most likely will continue in months to come as we navigate the COVID-19 waters along with the vaccine. So the state of senior care as an industry. Healthcare workers, for the most part, were not as affected as other industries as we have seen. And as far as from a consumer standpoint, we have noticed that there's a higher interest in senior care. So there are more people looking and clicking and calling to get more information. But what we're not seeing from a trend standpoint are more people joining in. We know there's different needs and different processes with skilled nursing homes versus with assisted living and memory care and independent living, depend on what setting you're in, and possibly different needs with home care. But we're not necessarily seeing where the business is flourishing as people are uncertain themselves of their own financial status and, of course, potentially being exposed at a greater scale in congregate housing than if they remained in their current setting. We've also noticed that there's a requirement for organizations, providers, to be more transparent with their reporting outcomes. There is a move and a push for this to happen at a federal level. We typically know this takes longer, so various states require reporting for specifically COVID-19 outcomes. Once again, observations have been, since all of us as providers are primarily focused on COVID-19, we're seeing some other quality measures decline because the state regulation and the state oversight is not as intense as it was prior to the pandemic. So what are we seeing? We're seeing other areas go down. Other areas of care suffer because all eyes and all focus right now are on COVID-19. I don't support this. I don't say this is right, but this is something that I've seen in my own organization and others as well. There's been lots of funding to support and try to help healthcare organizations, including in Connecticut. Millions of dollars have been given. And for our associates in our area, we've heard, well, where's the money going? Because it's not funneling to, not necessarily, I should say, to the associates, okay? A lot of the dollars are being spent on testing. A lot of people don't realize just how expensive it is to test our associates. And depending on your outbreak status and the number of COVID-19 positive cases that you have, you can be testing 1 to 2 times a week. There are millions and millions of dollars being spent. Just to give you guys an idea of the community size, the community that I was with had 73 associates, not a very large number. I'm now moving to a much bigger community, but 73,000, we averaged probably $4,000 a week with testing. And that was out of our pockets. And we cannot charge the insurance for our associates because we're the ones requiring the testing. So similar to the comments just made about the quality and the type of mask and someone else touching the mask, how do you protect yourself? Truly, it is PPE. And it's not very difficult methods in which to be used. There's lots of talks on what type of masks are best, surgical, cloth, N95s. What do you need if you're going into a person's space that is positive? Eye protection. I will speak to what we have done in our organization and what we have seen fit as the best method. We have moved to a place where surgical masks are used on a one-time basis. When this all started, we were not there. We did not have the supplies to be there. We had to use them for an extended, repeated amount of days. Having been able to source more material, we now have enough masks for everyone to use and dispose of upon touching. So what does that mean? You start your day, you get a new mask. You go to lunch, you take it off, you get a new mask. So we've advanced there. N95s are recommended. However, they should be test fitted for you. They're not as effective if you're not tested for the proper fit for your N95, because there will be spaces in between where they're losing the efficacy. With eye protection, for us in our organization, there was data supported from the CDC that it can be transmitted through your eyes. Most likely a lot of it is touching of it. So we did, and we are using eye mask and or shields. When dealing with residents with advanced late-stage dementia, we only use shields because the residents are not able to fully understand a certain 6 feet distance and often will come close to us as caregivers for affection, for care. So we do employ the full shields for that. We also then employed isolation carts for when someone was actually positive, which mean disposable gowns, head coverings, shoe coverings, and of course, always gloves. With this, we had biohazard waste bags that were inside each individual resident's apartment to be able to dispose of these properly. If things are not taken off and on properly, you still have a high risk of infection. It's really not just the products, but it's how you use it. I've seen during my rounds, lots of masks, but not worn properly. So it's constant cueing, it's constant reminding, it's constant education. And even though it can be very repetitive, it is for the safety of others and for the folks that you're caring for.
Ms. Mitchell, we have 3 minutes left for you.
Sure, thank you. How do you protect your family? We recommend to do the same that you're doing at work at home and when you're out, to be responsible, and mainly if you're feeling ill, to isolate yourself and separate yourself from your family until you can resolve what it is you may be experiencing. In the beginning, we were recommending that you take off your uniform in a separate area and try to disinfect before getting around your family. For the Covert Care Act of Connecticut, one research, it mainly protects small businesses. So as far as short-term, long-term disability, it's very difficult to speak to this at a general level because each organization is different in what they offer as far as pay if you're positive, and or what you're able to do if you have direct exposure. So it's very hard to make blanket statements because I'm finding many different things across organizations. So what can you do to get through these very difficult, challenging, unforeseen times? As a caregiver, as a contributor, as anyone working in healthcare, you can focus on yourself and your overall well-being. You have to be able to help yourself to help others. Allow yourself to feel. Name those feelings that you're feeling, talk about them, let them out. Do not internalize them. And for many organizations, tap into your employee assistance portal. There are resources there, counseling, just someone to talk to that may be able to help you with sorting out your feelings. And lastly, keep your spirits high. This is a picture of my team here in Maryland. I purchased a small token of superhero socks just to thank them for all that they were doing day in and day out. Because as we know, healthcare heroes, I like to call healthcare warriors, are our everyday heroes. We go on the front line when many people are working from home. We are in a setting, providing care to others and exposing ourselves potentially. So we just want to salute you and thank you for all that you do. Thank you so much for your time today.
Thank you so much, Ms. Mitchell, for sharing the relationship between the administrative side of COVID as well as the workers that you have to supervise. Given the kind of logistical problems we were having, are there any of our panelists on the phone? The phone numbers that are not, I see one. Is there anyone else on the phone that we need to identify?
I think that phone might be linked.
Pardon? The phone might be linked just for audio? All right.
I think that Lincoln might be the phone.
All right. Thank you. All right. And our next panelist, unmute. You just waved. Yes, you're unmuted now. Yes, thank you. Can you introduce yourself and give us a little bit of background to your work experiences on the front line?
Yes, my name is Joan Malcolm, and I'm a nurse at the facility that I work. Been there before and during and at the start of COVID. And I must say, at the beginning of this, words that I could use to describe our surrounding at the time: stressful, fearful, anxious, and all of this is due mainly to the unknown. We didn't know what we were dealing with, and I doubt that CDC, as we all know, knew what they were dealing with either, because this thing, COVID, was and still is very new to all of us, and we are learning as we go. I worked on the floor with dementia, a dementia unit, and of course, when we all started out with COVID, and then we learned about this social distancing, they really don't know anything about that. I mean, and then being the population that I work with, there's no way that you can distance yourself from them. And even if you try to, they're still up in your face. And what are you going to do? You can't push them off because, number one, most of them, they do have dementia already. So, you know, right away that their brains are not really operating the way, you know, it is supposed to. So, and they all had COVID, my unit. Each and every one had COVID. But at the beginning of this all, when we all heard about this thing that was coming down the pike, and some of us tried to put on like a mask, we were told not to wear any mask because nobody has the COVID, which they didn't know because there was no testing, no nothing. Like I said, we were all learning about this thing. So therefore, there was that fear and stress and anxiety. Everybody, well, am I gonna get this? And then as the days and the weeks rolled by, you know, and at this end of the country, people just started just dropping like that. And a lot of time I would go to work, it would end up like with just one aide and myself on the floor with 20 odd people. And because of these old sick people, what were we gonna do? You know, we had to roll up our sleeves and do what we had to do for these residents. And so it was really heartrending working with these people, seeing them so sick. It reached a point where one day I just lost it when I lost one of my patients, just like that. I passed him, he was eating, and the next minute somebody's calling me, Joan, come and look, such and such is not responding. When I went, grabbed the guy, threw him on the floor, and started CPR. Oh my goodness, and the guy just died just like that. And I lost it. So it was really heartrending and still is. And you know, as we have passed through this pandemic, all these months, and now we are seeing some of them have recovered, but there's such a difference in them. I can see where it has affected them mentally and physically. They're really not the people who they were. And even though they have dementia, yes, but I can always see the difference. There was also the trouble with staffing. We were always so short staffed because many people didn't want to come to work. Number one, a lot of them who had young children were fearful of taking it home to their children, didn't want to come. So that caused added stress on those of us who did go. And we, like I said before, there was not proper PPE. We were told to wear one, put it in a paper bag, use it for a whole week, and all of those things. So and then, you know, but all I have to say right now is that thank God I I didn't contract the COVID, you know. And with the testing now, we are being tested twice per week. And so far, those from of our workers who did get it have recovered and are doing well. And many of us really didn't get it, but overall, very stressful, I must say. Very, very stressful and very heartening, especially to see how it affects our most vulnerable members of society, people who have once lived their lives, you know, and only because of situation where they're placed in these homes for us to take care of them. And to see them being affected this way, some of them to the point where they don't even remember anymore how to feed themselves. And these are people who used to do it, you know, just to see some of them who have completely forgotten. You give them something to eat and they really don't know what to do with it. This is how COVID has affected a lot of these people. But so on the whole, what we're facing right now is still shortage of staff because many people still do not want to come into the facility to work. And another thing that we also face is lack of support. Lack of support support. I was listening to Miss Mitchell talking about how she handled herself in her facility and how she supported her staff. I would say lack of support and accountability and communication and being open and honest, you know. I felt that we were just somebody there to keep the place open, you know, so that the resident could still be taken care of. But where that empathy for the staff was concerned, and then there was burnout, and because of this burnout, people got, I mean, short-tempered and say and do things that they normally wouldn't do. But I'm telling you, this COVID thing is no joke. It is absolutely no joke.
Thank you.
Yes.
Thank you, Ms. Malcolm, for sharing sort of the short-term and the long-term impact and the potential long shadow of COVID, which will be with us here. Are there any panelists on the phone who need to step in? If you need to unmute, it's *6. If not, we have a couple of questions from the chat. First to Ms. Edwards and Ms. Malcolm, can you talk to us just a little bit about self-care routines and how you were both coping in terms of taking care of your mental and emotional well-being? Ms. Edwards?
As for me, I read my Bible more often. I pray, wake up in the morning and I will pray. And I always interact with my coworkers. They're always talking to me, and I have my 3 kids and my husband. And sometimes I take time for myself.
Thank you, Ms. Edwards. Ms. Malcolm, can you take the screen a little forward?
Pardon me, you can't see me?
Yeah.
My chair is kind of low.
Yeah.
I put something in it so I could come up higher.
Yes, we can see all of you now. I didn't want to
Okay.
interrupt you before.
Yes, yes.
And how do you practice self-care? And how do you take
as
care
for
of-
me, my faith. Thank God that I really know Him for myself. And if it wasn't for my faith and my trust in God, I don't see that I would have been able to cope. And beside my faith, I also have a good support system. People from my church who do pray. My family, and my children, my sisters, my husband, who are also my support system. But my faith, I would say, is my mainstay. Yes, my trust in God is my mainstay, because He's my rock and He's my protector. And of course, there are other things that I do to protect myself. I have to follow the CDC guideline, wear the mask, social distancing, wash my hands and things like that. We have to do that, you know, that is set up. But for my mental health and my mainstay, I must say, it's my faith that is keeping my mind, because this thing can make you crazy if you don't have your mind stayed on something.
Ms. Mitchell, you outlined the cost of testing and how that has to be absorbed by your organization. Can you give the audience a sense of what that looks like in relation to the cost of vaccinations?
So right now, We're not actually fully given the dollars for the vaccination. They're very new. We're just starting our clinics. But for example, out of pay when it first started was $120 for the PCR testing, which is the up in the nostril. And then we moved to the rapid antigen testing that was on site, which was a higher cost. But at least within 15 minutes, we were able to give you your results, and you could either wait to hear that you were negative and or go home and then we would call you. For us, we did pay people to come in for testing if you were off. So there were some labor expenses there, but we felt that it was important because many of our associates had other positions. For the vaccinations, I don't have a clear insight as what that's costing us because we're not collecting, we're a private pay entity, so we're not collecting insurance once again. But because we're in the clinic, I haven't seen the expenses related to such.
And then for all of the panelists, if you could, now that there's a better understanding of COVID, is there any improvement around resources and accountability in your organization? We've seen both ends of the continuum in terms of the work that CNAs and nurses are doing, and we've seen the perspective from an administrator. So can you talk about shifts in resources and shifts in accountability now that we're 11 months in? Who would like to start? Maybe Miss Malcolm?
Very little, I must say. Very little. Short staff as usual, more so than ever, because there's burnout. Because of short staff, and the staff that's there are picking up the slack, then there's the burnout. And there is still accountability. There is still hiding of mask. I mean, they're saying, oh, I have an open door. I don't know if they're really listening when people talk, you know, and express their fears, because there's nothing, there's no response to you go and express, I'm feeling this way. Nobody come and ask, how are you feeling? How are you handling this or anything like that? It's like you're on your own.
Ms. Edwards?
Yep.
Yeah. As for my facility, we're getting more PPE, but we don't have enough staff. And workers are getting frustrated, burnout, because after the big, I would say, I call it very rough time. And when everything smoothed down, the boss chose to lay people off because there was quite a few residents that had passed away. So they lay so much people off that now they can't find people to call in when someone call out from work. When you express, because we've been expressing about the shortness from October until now, and no one listens. It's sad. It take on a different meaning now. All I said is like, they don't care. They really don't care.
Ms. Mitchell, would you be able to give us a sense of what might be what can account for the vastly different kinds of experience that Ms. Edwards and Ms. Malcolm is having with their administration versus the way that you chose to handle your facility as an administrator, with the understanding that the lack of knowledge, the lack of resources at the very beginning of the pandemic would look very different 11 months in?
Absolutely. It's not a great answer, but it's a very different setting. And it's one of the main reasons why I decided to switch my specific settings from skilled nursing to assisted living. The margins in skilled nursing are very, very, very slim. So that is why you see much more volatile staffing, where literally week to week, when I was in the skilled nursing setting, we would literally look at shifts per per day and have to walk and send associates home if we were above our budget. It's very volatile. There's not much room for it. And so because of that, it is a much more difficult area to have satisfaction with staffing. The margins are just a lot slim. We're working with primary insurance dollars, Medicaid, Medicare. With COVID-19, Connecticut has increased their Medicaid dollars. There are some delays with payments. And then there's also trying to figure out who's going to fund some of the skilled nursing care for folks that are positive. So it's a different financial beast. It's not a great answer. So therefore, the organization that I belong to has been able to afford more benefits in the way of, they were able to give bonuses to the frontline from March until August. We also created a free meal program for associates because of the pandemic. And then we gave 3 bags of groceries per associate for from March until July. So there were lots of things that we tried to do to just say, we hear you, this is not easy. And in the beginning, no one could find eggs. So we tried to source eggs. And to the point of PPE and brown paper bags, we did that as well, simply because we could not find the PPE in the beginning. It was so chaotic. So it is a different setting and a different funding stream that allows for the different support and experiences.
Thank you. Can you also elaborate on a comment that you made in your presentation, which was that during COVID, both in the early stages and now, other areas of care have had to be overlooked. Can you say a little bit about the possibility of liability legislation being passed and what that means for the industry?
So, quite frankly, you don't have the resources to regulate it as heavily. It's not something that I believe will stand, because as surveyors are coming in for COVID-19 inspections, they can't ignore certain things, but they're limited as well. Their resources have changed as well. So state to state regulatory bodies, they are stretched and their focus has not been the same. I think what we will see in the coming months from the legislative standpoint is federal reporting, similar to Center for Medicare and Medicaid Services, that we're required to report certain adverse events. We're going to see that related to COVID-19 management. I think it'll be some time before that's formalized, but similar to the points that were made, are the proper PPE available? Are we following the infection control protocols? Are the chemicals effective? Are the shifts supportive? We should be seeing some of that in the next couple of months, but I think it'll take a while before that's on a national scale.
And then the last question, I'm very mindful of time. Ms. Edwards, Ms. Malcolm, and Ms. Mitchell, are you seeing any signs of hope that hospitalizations will decrease, or that now that there's a better understanding of the course of the disease, that at least the fatality of it will decrease, especially in Black and Brown communities? Why don't we start with Ms. Malcolm and give Ms. Mitchell a chance to catch her breath?
Well, I think it should, but to me, the reason why it would not, in terms of, not in the facility, because right now in the facility where I'm at, we have no positive, which is good. But on the whole, it should decrease, but people are still not doing the right thing. Because I know of people who have tested positive and still go to work. Not at the facility where I work anyway, but they still go to work. Why? They don't have no symptoms. Meanwhile, they're spreading the disease. People are not doing the right thing. And that's why it just keeps going like a wildfire. So until people really do the right things, not just with the vaccine, because I don't know what this vaccine is going to do anyway, but do the right thing, wear your mask, keep your distance, and wash your hands. There are people who still don't do it. So that's why the COVID will not stop.
Okay, so thank you for pointing out sort of our ordinary everyday complicity.
Yes.
In the rates. Ms. Edwards, what are you seeing from your end?
In my facility, I see a big difference with everyone wearing their PPE, especially since the flu season start. We have, because on the unit that I work is like the admittance floor, and it's too negative before they will take anyone in. And we had 3 positive that came in. When they came in, they were showing negative. No one had catch anything from them. Also, we have 3 staff at 3 separate times, like 3 separate times spread out, where they were positive, but because they are wearing proper PPE and keeping their distance, thank God, no one else caught it, and no resident caught it from them.
Thank you. Ms. Mitchell?
Thank you. So on a global scale, it's interesting to answer that as we're projecting nationally 40% of the general public to receive the vaccine. So it's really some time to shake out what we're going to see from the effects of that. However, I'm pretty sure that it will continue to affect Black and Brown at a higher rate, more negatively than others. There's a lot of mistrust with the vaccine, so there's a lot of work being done right now, how to target that community specifically and provide further education. I think it's great and it's fantastic to see better management in the nursing settings. I've shared with some of our team members, it's safer here than going to Target or to the grocery store if you do everything that you're supposed to do. So now that resources are more readily available, we can create a safer bubble potentially among organizations to be able to provide safe care and see less cases. What we are seeing nationally is that people are getting tired of the quarantine and limiting their activity. We've seen massive spikes with Thanksgiving travel. We've seen massive spikes with Christmas travel, holiday travel, and now we're seeing where on our end, a little bit more of the associates are affected than our residents. So I think time will tell how the vaccine will affect. And I just wanted to leave off by sharing directly from the governor's website press release. In the state of Connecticut, more than $94 million to date has been spent for testing in nursing homes specifically in Connecticut. So a large, large dollar amount there. And $60 million has been spent to help with PPE and additional staffing throughout Connecticut.
Thank you, Ms. Mitchell.
Thank you.
The stories, some of the stories that we've heard today, again, are shared in this book. And I wondered, Mr. Collins, if you could do 2 things for us. One, could you give us a little bit of information about where we can get a copy of this book? And perhaps if you can close us out with some reflections on what dealing with the pandemic has meant for 1199 and the future of care work.
Well, good evening, good afternoon, everyone. LaVon Collins. I work with Camba and Ms. Mitchell, Joan, and on behalf, I really have to say, I think the frontline caregivers are truly heroes in this time, particularly with the home that Joan works, right? Particularly that home, it forced the nurses there to join a union, right? Because of the pandemic and the uncertainties, and they needed to have a voice under that circumstances. So they joined unanimously and came under the banner of 1199. With regards to the whole pandemic, it is something that is difficult for myself to speak about, and even our members. We have on the line a member that shared with me tonight that she just did not want to speak about it. And hopefully she will speak about her experience at the next monthly event. She says she's just not up to it at this time and she retired. Me, myself, not being on the front line, but hearing these stories, it's really challenging. But I just want to say that it is very hard work, and we do commend that work. And we're at a juncture in time, so we have to address the future of long-term care in a very, very clear way. And the COVID-19 stories share a lot of stories directly from members of 1199 who went through this pandemic, who share stories that you can really get closer to that situation without having to deal with it. So Steve Bender is also on the line, and he works with the members to capture those stories. And also Lincoln Williams is on the line, and he has shared his story as well. Unfortunately, time does not permit, but at the next session, hopefully we can share some more of those stories. And we have to really come together to figure out how we can get the book out there, and so that the community can understand what caregivers went through and continue to go through. But for now, it is distributed through 1199, and Steve Bender has donated the initial copies to the community. And I just want to thank the Education Fund, the Training Fund 1199 for that. And I want to commend the West Indian Club for everything. And we really want to see where this can go, not just to address the issues, but change the environments in which our members work and address it also from a statewide and legislative session. We have made demands on the state that this work should not be done for less than $20 an hour for frontline caregivers, and we have begun to achieve that. And in that saying, we believe that all work should be paid, and people should be able to live a decent life. And I don't want to go on too long, but it's just a tough thing that we all are dealing with. Thank you. Thanks, everybody. Thank you.
Thank you, Mr. Collins. Thank you so much. The 1199 is really doing important work as a union to provide a platform and a voice for home care workers and workers in nursing homes. And as a historian, none of you will be surprised to hear me say that documenting the stories, right, is also a way of providing a platform and giving voice and providing a space for people to share their stories. So I thank you, Ms. Edwards. I thank you, Ms. Mitchell and Ms. Malcolm, for sharing your story. And I hope that those of you who are on the line will join us for a future session. I know that the kind of trauma that has been induced by watching your clients and your patients suffer by worrying every day about the health of your own family members and potentially putting them at risk, and then dealing, especially as an administrator, with the fallout of trust and the fear and the anxiety of your staff has got to be very difficult. And this pandemic is with us for a very long time. I thank the Hartford Foundation for Public Giving for facilitating this conversation, as well as the city of Hartford. It is 9:07. I would like to end here. We will stay on the line for a few more minutes, but we are officially ending this session. I thank you all for your attention, and I thank the Community Coalition for this very important conversation and the host of other conversations about everything from digital literacy to entrepreneurship to how small businesses are coping. Please stay tuned for further sessions and look out for our events on Eventbrite. Thank you. This is Dr. Fiona.
Ms. Vernal, before we go, may
Yes.
I say thank you? You are an excellent moderator, and thank you. And I want to say, Camba, thank God for you, and Link, and if you can hear me, thank God for you. And for the people that I don't know, praise God to all of you, and blessings, and thank you.
Thank you, Lori.
Thank you so much, and thank you guys for your attention.